Hello. Ethical decision-making in pharmacy practice is a major aspect of our daily lives. To facilitate ethical decision-making, I present to you today a framework that you might find useful and that we will be using in the series that FIP is presenting on ethical scenarios in pharmacy practice. The steps to follow in ethical decision-making are suggested as follows. First of all, we identify all the facts. And by that, I mean, not just, someone coming in to ask for something and that's it, but who are the people involved? Who might this also involve behind the scenes? What are the facts in terms of history, medical history, of any other aspects that might shed light on how to go about making a decision, and very quickly sometimes. But history taking is of major importance. Then we identify the ethical principles. This is important because also we need to know what's involved. Is it just an issue, or is it an issue involving, this principle and that one, which one is going to outweigh the other? Whether there are legal constraints is an important issue to identify as well. And very quickly you would know this because all practitioners would know their legal requirements of practice. And human value. Some people would say, why would I need to take that into consideration? Well, I would say because it's so important that we recognize the fact that human values plays a great role in healthcare. Take, for example, trust. If people don't trust us, how would they approach us? Empathy, sympathy. We then identify the options, and sometimes we only have a split second to do this, but we identify those options and we attach or recognize for each option an implication, something that's going to happen as a result of this decision. If I say option 1 has an implication going that way, and option 2 has another implication going that way. Sometimes the red face test is the one that is the clinching of the deal, so to speak, because it tests whether it's going to embarrass us, or is it going to embarrass someone? Is it going to be of concern to someone or to the profession? That would probably guide us as to where to go. We have to make that decision fairly quickly. Professionals don't have time to sit there scratching their head for too long, right? But we also have to know how to justify that decision. Justification of ethical decision-making is about the most important step in the whole process. And that is because we are accountable. And if someone calls us or questions us on why we made that decision, we need to have a good justification. And that justification isn't, well, I felt it was right. No, there are principles we can quote. There are principles of practice we can talk about. And because we're human and we make errors, no one is going to go through life without making some kind of mistake. We revisit and reflect on how it could have been done better, how we could have made a better decision. Could it have been better? Or was that the best that was possible? We reflect, we revisit. Sometimes we make protocols based on revisiting and reflecting. You might ask how we justify those decisions. So I'm going to go a little bit into what do we draw on? The main thing I would suggest would be to know your 4 principles of bioethics. Those 4 pillars are so important, and they cover most of the scope of our ethical dilemmas in practice. So try and remember those. I'll remind you of them in a minute. You might have a code of ethics handy, or you know it by heart, that would be great. But remember that principles that will help you from that code. And if all else fails, you could always go back to general moral philosophy, what's right, what's wrong, and theory. Sometimes it's something like, the greater good for the greater number, or social justice. That helps. It's not very specific, but it still helps to justify a decision if you don't remember for example, the principles of bioethics in healthcare. And here are the principles that I'm talking about. And their scope is amazingly broad and covering most issues. So if you remember beneficence, first principle being to do good, to do things in the best interest of the patient, and to do no harm, non-maleficence. Some people regard this ancient principle as one of the most important pillars of practice. And respect for patient autonomy is often regarded as first among equals in this day and age, when we need to respect people's individuality and their right to choose. And of course, there is justice. And this is based on the theory of social justice and equity and rights to access, just as everyone has the right to access medication and good health. So in summary, if you could possibly just remember this table, it will help you quickly run through quite efficiently through ethical decision making. What are the facts? Who's involved? What's involved? What ethical principles are incurred? What legal issues, if any, apply? What human values will move us to make one decision or another, especially if it's something to do with the patient's value? And what options do we have? What implications they each have of those options, and whether or not they pass the red face test. You make that choice, and you make sure that you have a principled justification to defend that decision. Thank you for listening.